Hi, our trust team has done a lot of great research on building trust, countering misinformation, and improving public health communication. But there's often no better expert than practitioners themselves. Stick around to hear more from my conversation with Esmer and Javier, discussing their experiences at Cameron County Public Health. Hey everybody, I'm here with Esmer and Javier from Cameron County. We're very, very excited to talk to you guys today. So first I'm going to have Esmer go ahead and introduce yourself and describe your role with regards to public health communications for Cameron County, Texas.
Well, my name is Esmer Guajardo. I am the health administrator here in Cameron County. Our department is about like 200 employees, give or take, and we have different departments with different programs within our department. And so communications was one of those programs that came in, one of the last that came in when I became the health administrator. But it was a huge priority for me, and this was one of my goals when I became the health administrator, so that we can be out there within the community. So that's pretty much my role, is that we have a program. It's one of the programs I oversee, but I'm very, very invested in this program, which we can talk about a little bit further down the conversation.
Awesome. And Javier?
My name is Javier Chavarria. I am the lead media graphic designer here at Cameron County Public Health. And my role here as a designer and editor, I basically, I myself and my team with community engagement, we go through various social media platforms, and we use our graphic designs and media as a way to communicate with the public and translate our information out there.
So tell me more about your communication strategy or philosophy, particularly with regards to public health emergencies. Cameron County is super impressive, and you guys have both a very robust on-the-ground team as well as an incredibly expansive online presence to help reach the community and build trust in the health department. So how did this strategy come to be? And maybe we can start with Esmer.
As I mentioned earlier, one of my goals as a health department director when I became the administrator, because I had been here for like 10, 15 years before that. I'm ready to talk about how long, right? But I've been here for quite a while. And so I knew that was something that was lacking. And of course, the other thing was going on at the same time on the outside was social media. That was starting to expand the technology and being available to the community. And so I wanted to create a communications brand, but I wasn't looking at the communications at the time. I was looking more as a branding, because I do believe that if you're a brand, you need to be trustworthy and people need to be able to trust it. And so I started with one employee, which actually happens to be Javier. Him, and he came on board as my computer graphic specialist. And so he's very artistic, and so he has a lot of skills and a lot of knowledge on how to go about it. But I started with him. And so the messaging the approach we wanted to take actually was that we wanted to be trustworthy, we wanted to be transparent, and we wanted to be consistent with our messaging, whatever it was that we were dealing with. And so but one of the things that we wanted to deal with, that we needed to make sure, was that we were being very sensitive to, one, HIPAA information, because we are public health. So anytime we put information out there, we wanted to make sure that we were being sensitive to it. And then two, we wanted to be sensitive to individuals. Lots of times, we have a situation going on in the community and we want people to know about it, a public health threat. We had to make sure that our messaging did not highlight, did not bring any kind of negative information about a certain population that we were talking about for whatever reason. We didn't want to interpret it as such. And so we had to take the client's information in hand. And of course, the other thing is we had to be culturally sensitive, because we live along the border. And so that was something Javier and I, we started off with, and over time we built up a team. We have now a director, we have two other communications graphics specialists, but we included the health educators. And so what we did was build a team that we came across, as we call it now, as community engagement. And one of the reasons this is because I realized, I was cognizant of the fact that I couldn't do everything. Javier couldn't do everything. We had to bring in health educators to the table, because one of the things that we knew they brought to the table is that they understood the communities. They understood what was going on in the community because they were out there all the time. I had my communications graphic team, such as Javier, who knew the technical aspect. I had my health educators that knew the community. And then you had public health specialists that knew a specific topic that we're going to talk about. And then there was me, leadership. because you have to have the buy-in for leadership, I felt. And so, because at the end of the day, any message you put out there, my name's on the line. And so personally, I have an interest in it, but two, I mean, I knew that this is part of what I wanted to put out there, and I was responsible for a lot of it. And so when we did, once we started building the team, I was very lucky that my team, they work well together, all of them, and this is the other thing too, is that you have to prioritize that team. This is probably the one team I meet with more than anybody else. I meet with them on a weekly basis. Every Wednesday at 10 a.m. is dedicated to them. We sit down, we discuss ideas, we go over drafts of some of the graphics that they've designed, and then we provide constructive criticism. And it has to be constructive. It's nothing personal. And we've learned how to do that and exchange the ideas. And so we discuss what's worked and what didn't work. And so over time, this is something that, we've gone through some growing pains, a lot of growing pains, and so, but I think over time, I feel like it's probably one of the best ways to do management, and not just of communications, but management as a whole. And I always invite my programs directors and my staff to sit in through this process, and they really enjoy it, and they're impressed with how we can take a simple problem that's out there in the community, a public health issue, and how we develop the plan to communicate it to the population. So this is pretty much how it started, and this is where we're at right now. Again, we've gone through growing pains, we're still learning, but that was the point behind it. We just have to be trustworthy and consistent and transparent. So, and I believe we're doing a good job with that. I think the message has resonated with the rest of the team too.
Much like how Esmer was saying, we've gone through our growing pains, and there's very much a process with how we do things. We don't just put out information as quickly as we can, as much as people would like for us to put out information as fast as possible. It's like we have to go through this process to make sure that what we're putting out is accurate, so that people don't question it, and it very much limits misinformation out there. We don't get a lot of fluff for that because we take the time to make sure that the graphics, the information, that it's all one cohesive and accurate thing that we put out there before the public even sees it. And very much, it started off with me, and, like Esmer says, growing pains, and it very much is, we learn, very much give and take, how I respond to, these informations and the input from my peers, and, how Esmer and the rest of the administration, responds to how, myself and my team work with the information that we have. We have I say that my job's simple but also complicated in the fact that we have to figure out how to make the information that we want to put out there easy to digest and attractive for people to want to read it and to be informed.
So you started talking about this a little bit, but I want to dig a bit more. So circulating misinformation and disinformation and general distrust towards public health can be very large barriers to community members engaging in the healthy behaviors that health departments recommend. Can you all provide an example of how you've tackled these barriers in Cameron County? And we'll start with Esmer.
Well, here in Cameron County, we've had our share of public health situations in the last 7 years or so. And one of the things, every time there's a public health situation, you're always going to have some naysayers. It just comes with the territory. Now, do I think that's increased more so after COVID? Absolutely. And I think that's what makes our work even more critical, because, all of a sudden we had not just a pandemic, we had an infodemic. There's so much information coming through. Who to believe? Who do you believe? Who do you want to believe? Who's going to be, who's going to believe you? And so we had our work cut out for us. And so, we've had a situation in 2016 where we had the second case in the nation, the first in Texas, Zika case in Texas, the second in the nation. And so we were pretty much standing out in terms of attention, in terms of public health. So we had the situation with Zika. We had to go out there door to door and obtain samples so we can find out to what extent Zika had spread in a certain neighborhood. And in order for us to be able to be successful, we knew we had to get the public to buy in, to be able to say, here, go ahead, collect one of my specimens and go get tested. But one of the things that we were dealing with is that the political landscape was starting to change. And with that brought a lot of mistrust because, we are along the border, the Texas-Mexico border. So you have a lot of people that are undocumented. And so we knew that our messaging had to be put out there that we were trying to be approachable, for the public to accept us. And to be trusted again, because without them trusting us that we were out there solely to do public health, we're not border patrol, we're not doing anything about documentation, we're actually doing a public health message. So our work was cut out for us in that regard. But then, then we had a dog seizure in 2019. And so we had to put in adoption services. But, the people that were most passionate about it were the ones that were coming after us in terms of making sure we found the right adopters, And so, again, we had to put messaging out there that told people, like, we're doing everything we can to make sure they go to good homes. So we're doing our background, the background work to make sure that these dogs that were picked up, that were being stored in a warehouse are going to good homes. And then 2020 COVID came around. How do you deal with that? I think that was probably the hardest one because there was so much information. But I do think that one of the things that's worked for us is by then, with just those two other situations, I feel like the public was starting to trust us. And so that when our messaging went out, people took advantage of it and actually read up on it. And the reason I think this is a good reflection of it is when we had vaccination clinics, we had people lined up, and our vaccination rates were probably one of the best ones in the state. And so, and I can't say that that's just a reflection of us, because I recognize that immunization levels in our area are pretty high as it is, but I knew that we're doing something right if they're not decreasing. And so they still continued. And then in 2023, we had a fungal meningitis situation with Mexico. And again, here we are putting out messaging to make sure that people that were tested, people that were identified as having received services in Mexico here and live here in the US did actually go get tested. And so we got a lot of feedback from it. But for all of those situations, we had naysayers. And so the difference is now that we have a team in place, and people we learned that people don't want to be told what to do. They don't want to be told. That they want us to give them the information, and they want us to be able to let them decide or let them know and understand why it's so significant that they do what we're asking them to do. And so, it goes from understanding our audience, creating like messaging that works for them and make sure that's efficient so that it's effective. And so this is something that we've done. And so the answer to all this, I think, it's that we just have to anticipate. And we're not going to think of everything. We're not going to think of everything that might come up with a situation. But, as soon as my preparedness director walks in the door and tells me we have this situation going on, my instinct is to get my communications team together. And so we need to put messaging together, because luckily in public health, we have a little window of opportunity. We have a suspect until the person's confirmed. We have like 2-3 days, depends on how long it takes to actually get lab results to confirm it, that we do have a few days, usually, and we're lucky we have that time frame to play with, but we know we have to start on it immediately. And so I think that's one of the good things, is that by us doing this and doing it, as much as I don't want to do it all the time, because you don't want these public health threat situations going on, there's always a silver lining to it, that people have exposure to you and to your brand, and so they learn to trust you. So I feel like we achieved some success in that regard.
I think one of the Ezra touched on a lot of really good points, but one thing that I want to add to it is one of the key things about building that trust has a lot to do with transparency and making sure that you're not holding back any information. You're making sure that the information is out there. You want to make sure that you can direct your community to the information that they need to know, but you also don't want to drown them in information, because then they're not going to want to listen. So there is a balance that you kind of have to work with, of like, how much do we want to tell people? How much do we want to tell people as far as like preventative measures versus like information that may not even pertain to what they need to know. And it's, all the information is important, but it's like there are key things that people should be doing versus like things that everyone is already going to know anyway. So there is an angle that you have to tackle these things. Knowing your community, knowing what your community wants to know, knowing what your community already knows, and then how what is the best way for your community to reach out to you for more information? And I feel like we've been able to figure out that balance pretty well with, not overbearing people with information, but also giving them the opportunity to reach out and to humanize ourselves with, you know, not just a block of text or information telling you what to do, but there's actually a person behind the information. A lot of times we like to include visuals of the people behind the scenes who are providing you that information, whether it be someone from our administration, someone who's providing you the services as well, an expert or someone, so at least the public knows that there is someone behind the information that we're putting out that they can trust as well, so that it promotes them to want to seek out more information or to receive those services.
Yeah, and I think too on that end, I think we don't dismiss the naysayers. We do take an opportunity of the more credible commentary and do something with it. Because obviously if they're hesitant to try to listen to what we have to say, and if they tell us on social media, they make a comment, we're gonna read it and we're gonna listen to it. We're not gonna just completely disregard it, because we're not doing anyone any favor by disregarding it. And so we listen to it. It's like, okay, how can we not so much prove the point, but turn around and how do we take that information and explain to them, just the way Javier just mentioned, where it's pretty concise, and it's pretty transparent information that potentially they might be able to say, hey, switch might go off and say, they might think that there's something that they might think that there's truth to it. And we think that, and it's frustrating as it may be, and is difficult to try to change the minds of these naysayers. Lots of times we just think, if we just convert one to sit there, their mind, convert the thoughts of one person, then we're doing something right. And so we just have to continue going. And that sometimes can be the hard part about the naysayers out there. It's just part of life. You're going to have them everywhere, but we just have to figure out how do we to understand them too. We need to understand them too. Not just, we're not doing any good to public health if we just listen to the people that want to believe in us or that do believe in us. We're not doing anyone any good. So we have to take what the people that have doubts, the ones that have mistrust, and figure out how can we just build up on it. And so we take that in consideration, and we take their comments very serious.
I feel like, yeah, a lot of times not a lot of times, but like the few times that we do have some naysaying in, like, for example, like the comment sections of like our social medias, a lot of times it's not something super nitpicky. It's just like maybe they didn't understand the wording of something, or maybe the phrasing was just a little off, and to that effect, maybe it's just a matter of like, hey, let's provide an update graphic of maybe something that we missed, um, or not something that we missed, but like the information that answered that question wasn't out yet. And so if there ever is any updates, we always make sure that we provide that information, going forward as well.
For sure. Those are really great lessons for other health departments to learn from as well. So I think we're on our final question here. And I'm actually going to start with Javier. What's your final advice for health departments right now during and between emergencies? How can health departments better communicate with their audiences and build trust in public health in an environment of misinformation?
I very much think it is very much important for, agencies to get to know their audience, get to know the community, embrace the times, learn from trends, see what is effective and what isn't effective, and learn from that. Build a strategy upon that promotes your messaging. Don't be afraid to be creative, and don't be afraid to be relatable. I think that's a really important key aspect, is that relatability is what helps you build that trust. Being open and transparent, negativity, misinformation, that's out there everywhere. It's very easy to spread that, but all of that very much falls by the wayside when there is that positivity and trust. And when there is that positivity and trust, that's something that you have to build, and it takes time, but when it is there, it's strong. And it's what helps build that trust as well.
I think Javier started off the right one, this exact same one as mine. It's like, know your audience, and if you don't, get people that do to the table, and invite those that know them even better. You need to be able to talk you need to know who your audience is. 2, you need to hire staff that know more than you do and that are going to challenge your thinking. We wouldn't be very successful if I sat in a room and they just sat there and said, okay, we're going to do what Esmer tells us to do and let's go. We're not going to get very far. And so, you bring these professionals into the table and they know their stuff. Then we bring the public health specialist and they know their stuff. And so we just sit there and, have a brainstorm, and people will say resources are limited, but there's a lot of stuff out there that's free to a very low cost. If we can afford to do it, and, this is not going to happen overnight, give it time, but I think we can be done. And the other thing is, as a health administrator, as a health directors, because at the end of the day, it's your name's on the line here, you have to trust your gut instinct. If something does not feel right, don't do it. There's been plenty of campaigns that we come across and we're like, let's do it. And then they'll run it by me and I'll just tell them, let me get back to you. And they already know that there's something that I'm just not feeling it, and I come back to it. I'm like, this is probably what the issue is. And so we figure out how to address it, but I have to trust my gut instinct. I can't just go with they spent all this time working on it. Let's just put it up now. This is messaging. This is very critical. And then the last thing is, you have to make this as a priority. You have to communicate with your team. You have to provide the feedback. You have to make that commitment to your team. Initially that was a growing part of the Growing Pains. That was one of my issues, was that I needed to sit down with them. And, I have a background in English writing. And so grammatically, I was constantly, looking at little things, and I'm like, it was something that's pretty lengthy. I'm like, hold on, but one of the things I learned, and this is where they get challenged, is that I may look for I want a perfect punctuation, but sometimes graphic advertisements don't need it. Mm-hmm. You're talking a different language. And so that's why, you have to sit there and trust your team and communicate with and make that commitment. And, and I think the beauty of all this and the beauty of public health is that everything applies to public health. So you can never have a dull moment. You can't sit and say, well, what can I talk about today? What can I put out there? What messaging can I put out there? You're always going to have something to talk about. And so if you have the opportunity to make it interesting, informative, and enjoyable, you have nothing to lose. In the meantime, you're gaining trust from the public. And so it's so rewarding. So rewarding when we put out something on social media or a video, or we're expanding. We have a podcast now, and we bring people in to be part of the podcast, and they're excited. They've never been on a podcast, and they're super excited, and they want to, and it's new to them because they're in the public health arena, and they're outsiders of public health. But we bring them in because, again, everything applies to public health, and so it's the new trend, and that's the way. Education is key, and I think this is such a low-lying fruit. You just have to make that investment. And a lot of it is time, but it's so worth it and so rewarding at the end of the day.
Thank you both so much for sharing your experiences, sharing your advice, sharing your expertise. I think lots of other health departments are going to love watching this video and kind of reviewing everything they have to learn from you guys. So thank you so much, and I hope you have a good rest of your day.
Likewise, Christina.
Mm-hmm.
Thanks for watching. For more information, go to our Trust in Public Health website.